Introducing ViSiGi 3D, the first FDA-approved calibration system intended specifically for your laparoscopic sleeve gastrectomy procedures. ViSiGi 3D's proprietary design allows for a truly visualized sleeve gastrectomy. Integrated into one product, you can decompress, delineate, and dissect your sleeves with confidence. Numerous clinically engineered features make the ViSiGi the device of choice for active bariatric practices. The thermoform blunt tip allows for ease of insertion by anesthesia, and its integral design means there are no accessory pieces to become detached during the procedure. A blunt tip reduces the likelihood of perforation and misstapling, yet lateral flexibility aids in the placement of the device. Internal reinforcement provides added hoop strength to ensure consistent external sizing diameter. A clinically engineered pattern facilitates controlled decompression, lessens the likelihood of clogging, and ensures consistent circumferential tissue fixation. Safe suction is provided by integral suction control that reduces high vacuum commonly found in the OR to clinically safe and effective levels to ensure maximum delineation. A vented selection valve allows the system to be inserted or removed with no pressure differential. Alternatively, suction can be applied for decompression and delineation. The optional accessory bulb allows for low flow, low pressure air to be instilled for pneumatic realignment or ultimate leak testing. This handheld device provides pressure levels adequate for leak testing, yet only a fraction of that found in your hospital oxygen outlets.
As you can see here, the image is depicting the positioning of the tube for decompression purposes. The image on the left is the Behringer tube, and the one on the right is just a very distended stomach, and you see anesthesia trying to pass an OG tube to decompress the stomach. Eventually you're going to have the decompression, but as you can see, of course, it's much easier and much more consistent and faster to place the Behringer tube as opposed to the regular OG tube. So let's turn our attention to the positioning of the tube on the lesser curve. Just by following certain steps, you can appreciate that the tube goes very nice and easily into the antrum. And because of the tubes and the compression that you can apply to the tube, you can park this hollow tube again very nicely and easily in the lesser curve. You can see on the right image that it takes a little bit of practice, especially if you're using a tapered bougie. You're gonna have to have several passes trying to park the tube into the pylorus, and sometimes even getting it there, it might not just stay in place. Where on the left side you can see that there's a great demarcation of the lesser curve and the tube. You know that the tube is in place. You can tell for sure that the tip is in the close to the pylorus, if not through the pylorus. You're not gonna have the risk to transect it with your first staple. On the other side, on the right side, you're going to have to be very careful with that. The images now depict the first stapling. We are transecting the portion of the stomach is very close to the pylorus. The antrum is very thick. You got to be very careful at choosing, the right height of the staple line. But take a look at the difference. The delineation, the demarcation of the Behringer tube is just so nicely visualized as opposed, to the regular tube, and it has to do with the suctioning and parking that you could achieve, with this tube into the lesser curve, and it's very intuitive. It's very easy to accomplish. You just follow that kind of crevice, and you put your staple right there, and you're gonna have a good formation of your sleeve, of the first portion of that sleeve. Be careful to not stay too close to the incisura, otherwise your sleeve could actually kink. As a final result, the image on the left side is depicting that the tip of the tube is very nicely positioned close to the pylorus, very nicely constructed and formed, staple line. There's no corking, there's no screwing, and on the other side, the results could be similar, but the ease of use of this tube is essentially superior, and that's what we strongly recommend. It's a great quality product.
To learn more about ViSiGi 3D or to schedule a product evaluation, please visit our website, www.ViSiGi.com. The ViSiGi 3D is intended for use on or by the order of physician. It is indicated for use in gastric and bariatric surgical procedures for the application of suction, stomach decompression, drainage of gastric fluids, irrigation, and to serve as a sizing guide. The material contained in this video is not meant to replace the complete instructions for use, which may be found on our website.